Hello, good afternoon, everyone. My name is Dr. Stelina Gowdy. I am a board certified family physician, and I'd like to talk to you all today about physicals. So, when you go to the doctor's and you plan on doing your physical, it is definitely a very important visit that you should be performing once a year. But let's talk about what that visit entails. So during the physical, typically what we're doing is screening to see if there is any medical conditions that need to be addressed. For example, when you come in, we do your vitals. When we're doing your vitals, we're checking for things like, is your blood pressure elevated? Has it been increasing? Is it where we need to start having a conversation as to what do we need to do to bring the blood pressure back down? We also check other things like your oxygen level, checking your temperature, heart rate, and things like that. And after your vitals have been done, typically we'll go ahead and do a physical exam, also get a little bit of history from you. Now, the one thing that I do want to point out is that when you get your insurance card, it does typically say that you do have one free wellness visit once a year. Now, when you go to the doctor for that free wellness visit, if at the time of speaking to your doctor, you mention that you're having, for example, you've been having chest pain or you've been having arm pain, of course, a good physician is going to address that issue because it may be something serious that does need to be addressed. However, the one thing that I do want you to be aware of is that if at that point we have to pivot to a illness or sick or what you may notice on your insurance card to say office visits, because there is a concern, an issue that needs to be addressed at that visit, then you may have to pay your copay. And I know some people go in, they say, well, I went in for my wellness visit and I was charged a fee. Well, the reason why you may be charged a fee is because it turned into more than just a wellness visit because there was an issue that needed to be addressed. But back on the topic of your wellness visits. So after obtaining some history from you, typically what your physician will do is uh, do an exam essentially head to toe for the most part. Of course, screening or checking to see if there is any abnormalities is again. So looking at your eyes, mouth, listening to heart, lungs, looking at your skin, abdominal exam, checking for swelling, doing a checking your strength, also checking your reflexes. Those are some of the things that you should expect during that visit. It's not an extremely detailed, but basic enough where we can identify if there is a abnormality. The next thing that is likely to be done is a conversation about some of those important preventive care measures that need to be addressed. And those are based on your age and your sex. So if you're a female and starting at the age of 21 years of age, that is when you will typically, it will be recommended for you to start to have pap smears. Pap smears are performed every 3 to 5 years now. If it is where you are due for that pap smear, it kind of depends on the physician. Some may be able to perform that pap smear at that visit, or after identifying that you are due for that, they may have you come back to perform that pap smear. The next thing would be mammogram, also for women after 40 years of age, and that would be 40 to 74 years of age, where mammogram is recommended every year to every other year. Also, a colon cancer screening. We start screening at 45 years of age, 45 to 75 years of age, and that could be in 3 different forms. Either a colonoscopy. Now, a colonoscopy is not performed by your primary care physician. That is typically referred out to a general surgeon or a gastroenterologist. Now, that visit typically is where you'll have an initial visit with them, and then at the next visit, they'll go ahead and schedule for the colonoscopy. Well, they'll have you drink a prep to clean out the colon, and then they'll use a camera to look through the whole colon. If that is completely normal, typically they'll say to return to perform another one in 10 years. The other way that can be screened for, to screen for colon cancer is a Cologuard. Some of you may have seen that white box that they've advertised on TV. So basically that would be where they send out a kit to your house, would be delivered typically via FedEx or UPS, and it has all the instructions on how to collect a sample and then how to repackage that sample and then send it back to them so that they can screen using that sample that you provided. That is typically good for 3 years if it's normal. If it's abnormal, that is when we'll say you do have to have that full colonoscopy. The other way is something that's called a FIT test. The FIT test is the same thing as is collected similarly as the Cologuard, but because it's not as specific, that one is performed once a year. So colon cancer screening performed 3 ways, either the FIT test once a year, Cologuard every 3 years, or a colonoscopy, which would be every 3 to 5 years if you have polyps, sometimes even 7 years, or every 10 years if it is normal. And also a DEXA scan. DEXA scan are performed starting at 65 years of age. Typically it's a one-time test, but if it's abnormal, that is screening for osteoporosis. DEXA scan is also known as a bone scan. So that is done after 65 unless you've had some, for example, if you use steroids for a prolonged period of time, or if you're at higher risk for having osteoporosis, that test may be performed a little bit earlier than 65. Now, the other thing that I wanted to also talk about is the vaccines. Let's start with the tetanus vaccine. So tetanus should be obtained every 10 years. So every 10 years you should be getting a tetanus shot or tetanus booster. Now, if you have an injury, sometimes we do a TD or Tdap vaccine. TD vaccine a little bit earlier, the Tdap vaccine. That one is typically every 10 years, or some women may get it a little bit more frequently. For example, if you're pregnant, then you would get it every pregnancy. So it kind of depends as far as the frequency, where it may be more frequent than every 10 years, but for most people, it is recommended every 10 years. The next one that I'd like to talk about would be the shingles vaccine. The shingles vaccine is also offered at 50 years of age, along with the pneumonia vaccine. The pneumonia vaccine is one that can also be offered a little bit earlier if you have other chronic conditions such as diabetes or COPD or asthma, or any condition that reduces your immune system. You may qualify for getting a pneumonia shot a little bit earlier, but for most people, it is recommended at 50 years of age. The other vaccine that is also recommended is the RSV vaccine. That is to protect you against a respiratory condition. Now, that one is recommended at 75 years of age, but also where if you have chronic conditions that put you at higher risk, it may be recommended at 60 years of age instead of 75. And then, of course, a flu vaccine every year and a COVID vaccine also every year now. Now, essentially, those are the main things. Blood work, of course, is something else that would be done at that visit. The one recommendation that I would say in reference to blood work is typically it is best for it to be done fasting. And if you want to ask your doctor if they'll allow you to do it a week before your visit, sometimes that helps to be able to talk about those labs at your wellness visits. But if not, some physicians do order it at the visit itself. And that typically would include things like checking kidney function, liver function, checking your iron count or white count, checking thyroid, screening for diabetes. Sometimes vitamin D may be included. So those are, and cholesterol. I almost forgot about that one, which is an important one. And also the main reason why we want it to be fasting so that we have an accurate cholesterol level or cholesterol test. That, those are essentially all of the things that you should be expecting at your wellness visits. Um, and definitely a visit that I recommend that everybody performs once a year because at times you may not have any symptoms, but that visit may be the visit where we are able to screen and identify and be able to get you treated early. Well, that was my main talk for today. If you are looking for a primary care physician, again, my name is Dr. Stelina Gowdy, and I am at Gowdy Family Care Center. We are located at 1500 Oglethorpe Avenue, Suite 3500 in Athens, Georgia. You can find me at www.gowdyfamilycare.com, or if you'd like to give us a call if you're looking for a PCP, our phone number is 706 410 2684. Bye, everyone.